I think the digital world gets in the way of kids being able to just have opportunities to sustain attention. If they can click and scroll and swipe and have new content, they're not really practicing how to pay attention. They also, to that same end, aren't really tolerant of being bored. And I can't imagine what life would have been like for me in the summers in the dirt roads of Virginia, not knowing how to tolerate being bored. So we're taking away the ability for them to be able to make mistakes and sit with the disappointment, sit with the frustration. The adults in the room can support them through it, but we're kind of taking away those opportunities for them.
We already know what helps. Connection is the cure. It's our deep, meaningful relationships that give us hope and healing. Welcome to This Helps. I'm Marlon Morgan, licensed professional clinical counselor and founder and CEO of the national nonprofit Wellness Together. Join us as we practice authentic and vulnerable conversations that inspire us to go deeper with the people in our own lives. Go to a little conference every year called Future of Mental Health Care. Ever heard of it?
I've heard of it because I've been there.
Oh, that's right. We were just there together. Mm-hmm. And I happened to be asked to moderate a panel of a bunch of totally smart, well-meaning, big-hearted people.
Yeah, kind and cool.
I loved them.
Mm-hmm.
We got Dr. Khadijah Booth Watkins. If you don't know, Dr. Khadijah Booth Watkins is the director for child and adolescent psychiatry training for Harvard medical students at Mass General Brigham. She is a child and adolescent psychiatrist, and she's the associate director for the Clay Center for Young Healthy Minds. She is one of the smartest people I've met, and also very, very nice, which those two don't always go together. You take Dr. Booth Watkins and you add a CEO of the Jed Foundation, John MacPhee. Saw this guy last week, and I don't want to brag, but I will, because he did something he didn't have to do and something I wasn't expecting. When I saw him, this was at a different event last week, and I said hi, went to shake his hand, and that very tall man, who I have to look straight up at when I'm next to, pulled me in for a hug.
What a sweet, kind.
Loved it. It made my night.
Great guy.
Made my night. And then finally, Merve Lapus, Vice President of Education and Engagement at Common Sense Media. This guy knows education, he knows mental health, and he knows how the media affects us. Common Sense Media has been doing some great studies and putting out a lot of results on how our entire society, but more importantly, our brains are being affected by the use of AI. So check out commonsensemedia.org. And at the end, I gave my 10 cents about the 4 C's. If you're going to use AI, the guidelines that I've been kind of going with lately, and I think a lot of this came out of our conversation with Ron Ivey, helped me to see it in a different way, which the 4 C's that I sort of came up with from that is, does the technology, does the AI allow you to stay competent, or does it degrade your skills and make you dumber? Because that is an actual research question that Common Sense Media asked in one of their studies. Does AI make you dumber? And does it get in the way of, connection when I really actually need to get connected with a human? Am I replacing it with something that's not going to meet that need, not going to give me purpose or love back, and not allow me to actually love or sacrifice or help anyone else? I mean, all those things we're built for that. And then finally, control and clarity. Do I have control of the technology, or is it kind of doing things without me knowing, or things that I wouldn't want it to do with my information? And clarity, what's it there for? And again, we think of AI as this amazing tool, which it can be, but if it feels too good to be true, that you can get any question answered at any point by a company and they're just trying to help you, it is too good to be true. What they're actually doing is taking all of the data from every question you ask and figuring out how to sell you stuff back. So just remember that. have some clarity about what it's really for. So the 4 C's: competence, connection, control, and clarity. Just, that's a start. Andrea, I heard you had a question for me, and my mom listened to a couple episodes recently and said, she was nice. She said she really liked them, but she wanted something helpful before the episode started. That way you have something that actually helps no matter what. You can go about the rest of your day. If you just start this episode, hopefully we can give you some information or some kind of coping skill that actually helps right away.
That's right. This is a big conversation folks are about to hear about mental health care in general, mental health in general. And I think when people hear like mental health care and mental health support, they might immediately think therapy, or like go see a therapist. What are some other forms of support that can really help your mental health?
There's some pretty low-hanging fruit in most of our lives, especially as Americans. There's some things that can help. I love the idea of just learning how to deep breathe in situations and get perspective, taking a beat, not stimulating our pleasure centers in our brains so much that we forget that we have actual purpose beyond avoiding pain. I think just your perspective is going to be, I think, what's most helpful to change. We get to thinking that everything's so important, and it feels that way, doesn't it? Like everything that we think is like truth, and that there's going to be a problem, and we know what it is. But that problem solving part of our brains, I mean, we can keep that busy, and sometimes that can be a distraction from the things that we need to do to actually help. So relationships, investing in relationships, talk to another person, even if you don't like them, at least you remember that you're a person and can have agency and purpose. Give yourself a challenge.
Mm-hmm.
Do something a little bit challenging, and that will help your mental health. I don't know if something's challenging for me is to try to work out every day. That helps. All of these like very basic things. Drink some water, get some sunlight. Even on a cloudy day, sunlight helps, especially if you have like 5 or 10 minutes in the morning to set your body clock.
Yeah, sunlight, water, move around.
Yeah.
I hear volunteering is good.
Yes.
I hear.
Remember what Dr. Lisa D'Amour told us? She said, it's hard to be depressed when you're also being helpful.
That's right.
It's why we do this show, to be honest. I would feel worse if we didn't feel like people were listening and we were helping.
Yes, I agree. And so one way you can make us feel better is by leaving us a 5-star review on Apple Podcasts.
Oh, you got them right where.
To let us know
that
you're listening, because we need it for our mental health.
Oh, that's good. That's good. It's right when people were feeling like, oh, maybe this is good and helpful, mm-hmm. And then it's like that little thing pops up, like, mm-hmm. Rate us now.
That's right.
Yeah. Okay. I see you. See you, producer Andrea. All right. Well, I hope you all enjoy this episode. It was really fun doing the panel and really informational. The people on it truly are some of the wisest, but also most caring people I've met, and hope you feel the same. This is an incredible panel. I can tell you that from experience. Each and every one of these people are, I would say, the go-to person with what they do and what we're going to be talking about today. Again, I'm Marlon Morgan, founder and CEO of Wellness Together. We provide mental health supports across the state of California and in New York City, human-based people and in the schools, so that helps distinguish kind of where we're coming from. And today we're going to talk a little bit about how things are changing and how we're scaling and all of those things. I want to give the panel a chance to introduce themselves and talk a little bit about the work you're doing currently and what makes you most hopeful. And really, I don't want to trick you, but it starts out hopeful, but then we really get into some concerns. So be ready.
So I am Khadijah Booth Watkins. I'm a child and adolescent psychiatrist at the core, and so I strongly believe in providing competent, compassionate care to young people and their families. And so that's what I do, but I think my life has shifted, and so I spend a lot more time in the realm of education. So I'm the program director for our training, child and adolescent psychiatry training program. I work with the medical students at Harvard who come through MGH to do their clerkships in psychiatry, and I work at the Clay Center where we kind of try to disseminate education to the public regarding mental health and supporting young people. So that's what I do, and I think what makes me most hopeful is that we're having this conversation and so many conversations like this that hopefully will move us well beyond awareness into a place of more of understanding and really action, because so much of what plagues kids happens in the dark. Stigma thrives in the dark, and I think having these conversations and with a broad audience, reaching more people is really what makes me hopeful, and it's happening so much more frequently and so much easier, I think, than it was maybe even just 3 years ago, and so that makes me hopeful.
Hi, everybody. My name is John MacPhee. I'm with the Jed Foundation. And we're a nonprofit. Jed Foundation focuses on this idea. It's a suicide prevention organization for young people, but on the idea that the places where young people live, learn, and grow, so schools, community-based organizations, communities, et cetera, can take actions to prioritize youth mental health and suicide prevention in the context of their boundaried communities, and really increase protective factors, reduce risk factors, and help young people thrive if it's done purposefully. And what we do is we help organizations, schools, school districts, community-based organizations do that work. What makes me hopeful is, young people themselves, they're amazing, and also, so many organizations like the University of Michigan, we just heard a great example, are doing this work and doing it incredibly well. Then I'll just echo what Khadijah said, also like groups like this, getting together and really, talking it out and trying to figure out how we can improve what we're doing. And it's a really important time to have these conversations about how we can improve what we're doing because of AI, because of technology, how fast it's advancing. It's giving us a lot of opportunities, but it is also presenting risks because it's largely unregulated and it's moving so fast. And so we do need to be talking and working together on this front.
Thank you. Good afternoon, everyone. My name is Merve Lapus. I'm the Vice President of Education and Engagement for Common Sense Media. Common Sense is also a nonprofit organization. Our whole focus is really focused on how do we provide enough resources, research, and ensuring that we can make the best decisions in regards to how we allow media and technology to play a role in our lives. My work is primarily focused around how we work with K-12 schools, as well as kind of the pre-service teacher training, and really ensuring that we are fostering critical thinking, creativity, really kind of these human core skills, in addition to preparing our kids in a world of media and technology that's pretty much a big part of the way that they live. And so a lot of my hope really comes in when you provide the instruction, when you provide the support and the resources. Kids are a force. They can come and they can direct where they want to see the future to be for them, but we need to provide them the space, we need to provide them the insight, and we need to do it purposefully and not just provide them a voice that goes nowhere.
Great. Thank you. Merve, you've done a lot of work and research promoting and even creating some of the digital tools that our students use. What have you seen help with resilience, digital literacy, and/or early intervention for mental health?
Sure. So I would say that the wins are there, but it's much narrower than the hype might actually kind of allude to. I think the reality is that mostly the wins will show up when a product is actually a connector to real services or to real people or real clinicians. Anything that is purporting to be, I can be the service, all you need, that is not helping, right? The clearest area of benefit is in information access and in kind of early help seeking. The research found that most kids and teens have already done some lookup, some research. They're following a content provider. Hopefully they're following clinicians to get an understanding of kind of how to support their mental health considerations and needs. And it matters enormously for kids where there are no clinicians available. I would say we see the greatest amount of research in spaces where there are just not clinicians available at all. And so it's no wonder that they are going to be turning to some of these digital spaces as ways to get that help. For a lot of kids, well-designed app or teletherapy, that should be their first kind of entrance into the door. It should not be kind of the resolve to them looking for support. And then also when it comes to education, we found some really strong proof that when you provide kids strong access to digital literacy, well-being, AI literacy, that kids can really thrive in the way that they look at media and technology. They can develop more of a nuanced view in how they use it. We have over 96,000 schools in the US and over 1 million educators that access our free content to teach this stuff in the classroom. And when we do that, we find that kids are able to think more critically. We find that they are able to recognize when the tool can bring them to the right types of resource versus going to tools that claim to be able to provide them everything that they need.
Follow up to that.
Yeah.
So earlier this fall, Drs. Nina Vasan and Daria Georgievic put out some of the first research that we've seen about how reliance on AI is affecting our students. And, CSM, Common Sense Media, put that out, and it was really interesting. Can you talk a little bit about that research and maybe how we distinguish between what truly supports mental health versus what might be harmful?
Sure. So I think what we've wanted to do was really look at these platforms that are providing these kind of chatbots or even these companions and what they purport to be able to do for our youth. And what we wanted to ensure was after we look at the guardrails that were put in place, how are they actually really supporting, and is there a potential issue or a challenge with these tools when you kind of test the guardrails out? So in looking at kind of this rubric question, we propose like 4 main questions. The first one is, does the product treat itself as a bridge or a destination? So again, I mentioned earlier, the most effective products are going to bridge to real clinicians, real peer-reviewed information, crisis lines. They're playing a fundamentally different role versus trying to be the relationship, right? An AI risk assessment that we released with the Stanford Medicine Brainstorm Lab last year also found that leading AI chatbots consistently fail to recognize and appropriately respond to mental health conditions affecting young people. Now, we heard earlier today that most young people, they're leaning in on these AI chatbots as a place to go. They're affirming them sycophantically. They're not making them feel judged. And we have 3 out of 4 students are leaning on them as their main way to be able to explore their mental health. So they're not going to real people, or it's taking some time before they get there, right? I think that the second thing is, does it hold up under realistic use or only in demos? We've seen a lot of demos about how these are going to be great and how they're going to support, but when we pressure test them, when we act like a teenager, which many of you guys have either you remember being a teen yourself or you work with teens, they're going to ask as many questions as they can. They're going to try to break things, right? It's just what is normal in nature. And when that happens, they jailbreak the entire system every time. It'll start to walk you through how to do the things you don't want them to hear. So just to give you a little idea of scale, how many of you, just guess, just throw out numbers. How many prompts per minute is ChatGPT getting as of like January 2025, right? It's gone up now, but how many prompts per minute do you think? Throw out a number. 1 billion's a lot, but it probably wouldn't get, yeah, I did invite that now, I kind of, so 700,000, right? 700,000 prompts every minute of the day. It's receiving some kind of prompt in response, right? And that is only growing. So making sure that what they're doing is actually realistic and not just a demo function. And the reality is there's a lot of strong demos that are out there. The third is, who is the product optimized for and how do you know? So harmful products are gonna really optimize for time. They're gonna keep them on. They're gonna check up on them. Hey, you still there? What can I do for you, right? Versus products where they actually are gonna celebrate the fact that we got you to where you needed to go. You found the right place to go. We pushed you in the right direction to find real support. And then the last thing is, what does the product do at the moments that matter most? A kid mentioning hallucinations or a plan involving self-harm or negative shift in language, the safer product is gonna make sure that it escalates to a human or refuse to continue the conversation forward. Any other product is gonna keep you going and talking. That is a problematic chatbot, or in this case, it is a problematic companion, right? Because they're developing for that. Most teens are starting to see kind of these major technology companies and what they're doing, and they don't trust them for their future. But it's also the most accessible thing they have. So we need to rectify that reality.
Thank you. One bit of information I shared recently is, and I just think this is important for context, even especially for the next question. In 2024, the top 3 Gen AI, ways that we were utilizing Gen AI is to generate ideas, and then second, therapy and companionship, and then third was specific searches like for research. In 1 year, therapy and companionship, so 2025, went to the top of the list. 2 was starting to help organize people's lives, like kind of a personal assistant. And 3, this is the big one that I think we're talking a lot around this today. Number 3, finding purpose in life. That's the one that I think takes, is that going to move up? Is that going to move down? Is it going to be important as we move forward? So with that context, John, where are we overestimating what this technology can help us do, especially when it comes to students and youth who are higher risk and who have complex mental health needs?
Okay, so where are we overestimating what it can do? I feel the need to first say, and everybody I think understands this, that what is it designed to do and who's producing it? And since we're talking about youth, oversimplifying it, but one category is what we're here to talk about, or what many of you are working in, which is how to use AI to better deliver healthcare, right? Another bucket is the general purpose AI, chat, right? ChatGPT, Claude, et cetera. And a third bucket is a bucket that is trying to use AI to make money, profiteer, off children and their time and their relationships and attention, et cetera, right? And I think we have to keep an eye on all 3 because all 3 present different risks and are all part of the, the system. I'm least worried about what's happening here, even though I think there's need for regulation and shared sort of norms, et cetera. But what I would say to answer your question is, look, the protective factors for youth mental health have been discussed, a lot of them here today. It is connectedness, right, and belonging and purpose and relationships. It's very human-rooted. It's problem-solving skills, coping skills, emotional regulation, self-awareness, a willingness to seek help if you're struggling, a willingness to give help to friends. It includes things like religiosity actually is protective and these kinds of things. I think we're overestimating, or I fear that we're going to overestimate what AI and tech can do when it's infringing on those things, and reducing, human connection. It can do a lot related to scale and pattern recognition and these kinds of things. But I'm afraid that it's going to, if we're not careful here, it's going to change what has been a relatively stable set of protective factors for mental health and well-being and suicide, and risk factors, and going to start to shift those because it's going to change, the way we live and the way that we connect with others, et cetera. So that's where I want to make sure we don't overestimate.
Yeah, that makes sense. Khadijah, from a child and adolescent psychiatry perspective, where are we at risk of kind of short-circuiting the development, maybe brain development, developing as a resilient individual, if we become too highly reliant on AI?
I think it goes back to a lot of what John just said. I think it's really about impeding the fundamental developmental processes that really help kids to understand attachment, social emotional intelligence and reading social cues, how to self-regulate and emotionally regulate. We think about kids who struggle. I think the digital world gets in the way of kids being able to just have opportunities to sustain attention. If they can click and scroll and swipe and have new content, they're not really practicing how to pay attention. They also, to that same end, aren't really tolerant of being bored. And I can't imagine what life would have been like for me in the summers in the dirt roads of Virginia, not knowing how to tolerate being bored. So that's important, how to be able to self-regulate, self-soothe, and then also kind of problem solve. How am I going to not be bored? Granted, we probably didn't come up with the best ideas, but we had a lot of fun. We learned some things. We made some mistakes. I think when we're thinking about building resilient kids, taking away this opportunity for them to begin to work on the critical thinking skills and problem solving skills, we're taking away the ability for them to be able to make mistakes and again, be able to kind of recover from those mistakes and sit with the disappointment, sit with the frustration. The adults in the room can support them through it, but we're kind of taking away those opportunities for them. And this is, I think, where we're really going to struggle if we don't forget that those things require kind of a person. It requires, again, a relationship. It requires some oversight that really just can't be done through a script or through a bot. It really requires that human connection for the adults in the room to model, but also for the kids to practice. If they don't practice it, they won't learn it and they won't grow.
Based on that, I feel like, going out of order just a little bit, I want to follow up. What does it look like when in clinical practice, when you see a student's resilience weakened by kind of relying on technology?
It kind of looks like they, again, don't really have the skills to even begin to figure out where to start to address the concerns or to solve the problems. The parents, for a lot of times, don't really kind of understand that we're really dealing with a skills deficit as opposed to someone who just can't do. And so how do we kind of take a step back and teach the skills? Again, I think when I talk to parents about building resilience, again, create opportunities for kids to solve problems, create opportunities and space for them to make mistakes, and then support them through that process of disappointment, frustration, and encourage them to try again. That is a lot of times completely lost, especially with this immediacy of this immediate gratification, this inability to kind of tolerate, again, distress. So it looks like kids coming into the office and they just don't have the bandwidth to tolerate disappointment and distress, which leads to like frustration, anxiety, depression in a way that we haven't seen before. And so I think the lack of those skills really hinders our kids to be able to become strong, healthy adults in a way that we're relying on them to learn these skills, again, on the screen, where it really requires us to model and teach and support them through these skills.
Yeah, I feel like we learn best from each other still. I think we've been evolved to the point where that's the quickest way for us to learn something still.
Some of these things, yes.
Yeah. Merve, is there in the research anything to point out the creativity, lack of, or gaining or increase of creativity when it comes to using these tools?
Well, so I think that's really interesting when we think about kind of like creativity and productivity. I mean, when we talk to educators, we talk to them about how are your kids using AI. I think someone brought it up just before as well. Like the assumption is just it's all about schoolwork, and if anything, they're probably cheating, and that's kind of how they see AI when so many of the kids are using it for so many other reasons, especially around mental health questions. But when it does come to the academic side, and we did this research where we looked at a national representative pool of kids representing like teenagers, and in that research, like most of them have all said, oh yeah, we use AI. I use AI, and in school, we use AI for the classroom. And when you poll the teachers, reality is those teachers haven't been asking them to use AI. It wasn't part of instruction. They're just doing it naturally. So they're picking up these tools pretty fast. They're doing it independently. Then you ask those same kids' parents around the exposure to AI and the way that they use it. Only a third of parents even knew that their kids were using AI. So you couple that then with schools are now pressured to pass policies around AI. They're being pushed by the federal government to bring in policies around using AI. And then you've got different states and you've got pushback in the classroom. Like, what do we do with this? Why do we need to use this? I don't know that we're prepared. So now you've got this ground zero in schools having to contend with not just bringing AI, but there's even a bubbling pushback around screen time and technology in general in schools, right? So kids are caught in the middle of all of this. And that means we've got this heavy adoption that we know of. We have very low adult awareness about what they're doing with it. And we've got almost no guardrails around policy. So what can happen? Who knows, right? So it's incredibly important to make sure that the best that we could do is try and build up our kids' understanding of what these tools are, how they work, how you should think about how you might use them, how they might potentially be problematic because of the fact that they are sycophantic, because they are biased, and because as of So this was just, in 2024 was the first time we saw that there was more traffic coming from bots online than there was people. So that means as AI is scraping online, it's scraping itself. So all of that, junk is what's informing what's being created. So it's incredibly important that they understand how or if or when they're going to use it. And the more we've also found, the more that you can provide this kind of instruction, kids will develop much more of a nuanced view and how they see it. And that is, I think, the most important part because they're going to be moving forward living with this stuff. I think the last thing I'll say, so one of our risk assessments with Stanford also found that because chatbots show confidence with homework and general questions, teens and parents may unconsciously assume that they're equally reliable for mental health support. So it is this trust transfer. They are so good at getting me the information. They seem to be right on and spot on every time we ask it something. When it provides me information about how to navigate questions around my own well-being, it must be just as good, right? And that is an unintentional trust transfer that we're seeing a lot. And that is something that it is, again, how do we then guide our families, educators, students in navigating that reality?
Don't say I didn't warn you. It is getting a little scarier as we get this 20 minutes progresses, but we'll try to end with some hope as well. John, I have a two-part question for you. What areas still need to remain human and remain sort of human-centered model where they're delivering care? And we had a conversation before where you said something what I thought was really profound, so I'm going to ask about it here. We often hear with New Mexico, California, and a number of other countries, is this technology's big tobacco moment. And you had some other ideas that may be more appropriate for the current moment.
So I would say what needs to remain human. I think we've touched on a lot of that here, but it's relationships, right? And I would say also emotionally responsive AI, right, should not be allowed to children. Just should not be allowed to children. And this is one of the issues John Torres talked about earlier today, where we can't expect a lot of regulation. I mean, but there really should be some sensible regulation and guardrails around, AI. And I'm not talking about, again, the therapeutic. I'm talking about the general purpose and an AI designed to capture young people's time and attention and relationships should be required to remind that it is a bot, right? Should have to refer to human care, should not pretend that it's a human being. These kinds of things. And we'll get there, by the way. We'll get there, whether it's through regulation or legislation or through the courts, we will get there. But the question about big tobacco, I think big tobacco is a good analogy in a lot of ways. It's brought up a lot as an analogy. But I would also encourage us to think about the pharmaceutical industry and the medical device industry as an analogy for this field, because unlike tobacco, tech has a lot of benefits to it, but it has potential risks or adverse events. So like medicine, I think we can look at that regulatory framework, and that regulatory framework was developed over years, right, over a long, long time. And in that industry, there were a lot of missteps and overreaches by industry. Where we are today is that all clinical trials or all data that is generated has to be made publicly available. If you're conducting a study, it has to be on a registry so everybody knows that you're doing that study.
Transparency.
Transparency on who you're giving money to in the healthcare system, right? The Sunshine Act. Restrictions on how you market, fair balance about adverse events. You cannot market to children. There's a whole regulatory infrastructure there that's already in place that was built in a bipartisan way. And I'm not saying it translates exactly, but I think in my view, it's a better model than some of the models that are being discussed more frequently.
Yeah, it made me feel a little more hopeful, and I think you also had made the point that AI is not a tool, or it's not comparable to tobacco in that tobacco doesn't have a lot of positive uses, and it certainly I don't think is sold that way, and so I think Yes, I mean I think the challenge in the biomedical model that I'm
saying we should look at as a model is just that it moves very slow, and we need a regulatory model that moves very quickly because this technology moves very quickly. So we have to find something new, right? But we are ultimately going to need to find something, or industry's going to jump way ahead, and then it's going to catch up through the courts, like is happening with social media now.
One of the areas you're starting to see a lot of push is in the states, where they are trying to push these more policy-driven solutions in the states where these companies are based out of. So you're going to see a lot of this in New York, a lot of this in California and some of the other states, because if we can't do anything more nationally, which we are seeing globally happen, the best we could do is within the states, and you're going to see a lot of those things. So your insights and your perspectives and how to push those more kid-focused policies around technology, and especially around AI, is going to be incredibly helpful.
Thanks. I think all coming down to clinically, Khadijah, where can we be sort of hopeful about scaling mental health care using technology? And what are the areas we sort of need to pay attention to? Is there a point when it sort of breaks down and is no longer helpful to lose the human relationship?
So scaling can be really great as we're thinking about coping skills and strategies and increasing psychoeducation to people. We talked about how important this is for resilience and for just health, feeling that you belong and that you're part of a community. Where we have to be careful with scaling is where we are clear that we cannot lose the human or relational component, where that human relation component is essential and can't be substituted. So when we're thinking about working with people where the process of healing has to happen, and it has to happen in a room with a person, because through therapy or through the relationship with the doctor, you have to have, relationship, you have to have trust, there has to be an emotional attunement and empathy, and there has to be someone in the room that is assessing you every time you come in and able to pivot and meet you where you are on that day of the appointment, to be able to engage with you, to be able to build that relationship. You can't do that again on a bot or through a script. So that's where we have to be careful when we think about scale and really be clear about where there can't be a substitute. So again, a lot of the behavioral components, the things that are really just kind of, again, problem solving, skills building, things that are just really concrete. But I think dealing with, again, people who maybe are struggling with trauma or suicidal thoughts or self-injury, things that require, again, a person to be able to evaluate and judge and pivot on the spot and meet a person where they are currently in that moment, is really important to not lose sight of.
That's great. I've also heard it put, Ron Ivey from Noesis Collaborative and the Harvard Center for Human Flourishing put it like, we can gain a lot of knowledge, but it's really hard to get wisdom from Gen AI. And there's a lot to that, which we don't have time to unpack. But before we ask this final question, and everyone gets 15 seconds to answer, I'm just going to say that, in prepping for this, I tried to think of the most sort of streamlined, easy to remember way that I often use when we serve lots and lots of students in schools, and we make the choice whether or not to bring in certain technologies. Does it make humans better? Does it help human flourishing? And I had the three C's, and then I added one during this. And the three C's are: does it allow people to stay competent? Does it allow them to stay connected to each other? And are they in control? And the fourth one I'll add is clarity, sort of that sense of transparency. What is it actually trying to do? So that you know that as well. So with that in mind, and at least now 5 seconds to answer, what would it look like for technology that allows for human flourishing?
Well, do I have to pick a C?
Well, you don't have to. I'll be offended but if you don't.
All right, if you can help me turn. I would say that I want to see young people maintain their agency, as they use these tools.
I think I don't know. The thing that's on my mind right now is kind of how do we disrupt positively the way that we look at kind of education and the way that technology plays a role in education. The reality is when kids get a writing assignment back and it's redlined, that's just it. That's the answer. these are redlined, and now I need to make those adjustments. Now, when they get a prompt back around their writing from ChatGPT, what they get is, okay, that's just the answer. We're not changing the way that our kids are thinking. We're just replacing it with a different tool. So it is incumbent on us to really get them to recognize that there's a way to disrupt the way that we learn, the way that we do these things positively, and that there is agency in that opportunity.
I'm uncomfortable because so much of this is driven from the corporate sector, right? And sort of from a profit maximizing sector. And that's a real problem in all this. We need a public infrastructure for AI so that, the creation of what this looks like is coming in a more sort of multidimensional community kind of way.
Yeah, what if OpenAI stayed nonprofit? I think maybe a lot of us forgot that happened.
This is a critical stage of remodeling for young people, and I worry about it being a muscle. If we don't use it, we lose it. So not learning those basic fundamental human skills of problem solving and critical thinking and how to be interpersonally effective in social communication and conflict resolution. Those things, again, we can't learn on the computer, and if we don't teach those skills, they whittle away. And I think this is really, maybe it'll be a C. You can make it a C.
I'll try. We'll get together on this. So I really want to thank this incredible panel. This was great information. Thank you all. And thanks for having us. Thanks for joining us today. We hope it helped. Stay connected at This Helps Podcast or at thishelpspodcast.com. The best way for you to support this show that you love so much, that is so near and dear to your heart, is by leaving a rating and a review wherever you get your podcasts. You need to know that really makes a difference. And if you could also just, tap that like and subscribe on YouTube, and you'll never miss an episode. Normally, I don't like the idea of being glued to your screen, but if it's to watch this show, double standard. So see you next time.